Imagine the scenario, your chest tightens, you can't catch your breath, and you're scared. No, it's not a heart attack, it's asthma. And now imagine how a child would deal with that situation. Joining me today to discuss what parents can do to help is Colleen Wesley from the Breathing Association, along with Madeline Chamard. Thank you both for being here, ladies. You look so pretty, Madeline, in your pink.
Thank you.
You knew exactly how to dress for TV, didn't you?
Well, thank you for having us.
Colleen, how many children at this point do we know have asthma?
Absolutely. Well, in America right now, about 20 million people have asthma, and out of that, about 7 million is children. What you'll find with asthma right now is it is the third leading cause with children 15 and younger for emergency room visits and hospitalizations, as well as it's one of the most common reasons why children are missing school.
And we're seeing more and more of it. And do we know why?
You know, the reasons could be environmental. There's a lot of studies that are being done on this to try and figure this out. We do know some of the causes can be hereditary. It also can be smoking during pregnancy, so very important to take care of yourself during your pregnancy. No smoking, bad quality air alert days. Pregnant women want to stay inside. That's all very important.
Now, Madeline, can I ask you, how long have you had asthma?
Since I was a baby.
Since you don't even remember how long, right?
Yeah.
What do you have on your lap there, hon?
My inhaler. I take it every morning and night.
Can you show me how you do that? Okay.
All right, what's the first thing you always do before you use it?
Shake it.
Shake it up.
Okay.
Real good. And you'll notice she has what's called a spacer here. When you use an inhaler like this, when you spray it,
right,
the medication comes out very fast, so it's very difficult to actually get the right dose. So this right here, the spacer, gets them about 85% more medication.
And
so
is
very
this for
important.
Adults as well?
And children.
Oh, okay.
Everybody should be using a spacer.
Okay.
All right.
So show me what you do here, Madeline, every morning, huh? And night.
She takes a big, deep breath in, bigger, deeper breath you take in, more medication, and then she's holding it for about 10 seconds.
Very good.
Nice job.
Nice job. And what medications do you take, honey?
Singulair and Zyrtec.
And then a steroid inhaler to help decrease the swelling.
And you're a gymnast. You take gymnastics, right? Do you find it hard to breathe sometimes when you play gymnastics?
Yeah, sometimes.
So what happens when that happens?
Well, nothing really happens. I'm just fine. I just need to take a break.
So you know when you need to take a break. You can feel it, huh? It is amazing how someone like Madeline and Colleen really knows how to take care of herself at the age of 10.
Absolutely, absolutely. Education is so important, and children with asthma really need to understand their medications, understand their limits. You know, there really shouldn't be too many limits. They should be able to do whatever sporting
running
activity
sports,
they want,
soccer, and all those
anything
things
they
that really
want.
are running
exactly.
sports.
And they just need to know they need to have their emergency medication there in case they have any problems. They may need to take a 5-minute break to relax, but other than that, they should be out there doing everything that anybody who does not have asthma should be doing.
So that's a little bit of a misnomer, because people think, I think, if children have asthma, they can't do a whole lot.
And that's absolutely not true. They should be out there doing everything they want to do.
What about adults? What's different in that regard as far as activity levels? Because they're children, you know, and they're just, I don't want to say, they got a lot more energy that they're able to do it? Or adults, some adults in their mind just think, I have asthma and I can't do anything.
And that could be because that's what they were taught when they were younger, and it's just stayed in their head. But no, there's
so the thought process has changed.
Exactly. There should be no limitations for adults. They should be out doing anything they want to do as well.
And most people deal with it this way, Colleen, with medications and with inhalers?
Exactly. To treat asthma, we're going to use medications. We also need to pinpoint what are your triggers. What causes your asthma to be worse? I know one of the big ones for Madeline can be cats. So sometimes we can have cat dander.
So you can be allergic and that can to some things, and that can spur an attack.
Absolutely, absolutely. Cigarette smoke's a big one. Infections, cold, stress, emotions, all of that can actually trigger your breathing.
So Madeline, you don't like to be around cats sometimes?
No.
That's too bad, huh?
She loves cats, but they make it a little bit hard to breathe, huh? Exactly.
Will Madeline ever be able to be cured? Is asthma curable?
Asthma is not curable, but the most important thing to remember is asthma can pretty much always be controlled. By the use of daily medications, you can live a normal daily life and everything can be controlled, but at this point, no, it's not curable.
But you can control it.
But you can control it, exactly. And May is Asthma Awareness Month, very important. May 5th is World Asthma Day, and there is going to be a health fair here in Columbus. We're going to have a clean air fair to let everybody know how to keep Columbus air cleaner, so children like Madeline
That's right.
breathe. Exactly.
Well, we're going to have that information on our website for everyone who's interested. Colleen, thank you. And Madeline, thank you. It's been a pleasure having you on my show.
Thank you. Thanks for having us.
Bye.